Hi, hello everyone. I am Batel Wachspress and I'm occupational therapist. And it's a real pleasure to be here and sharing my doctoral research with you all today. The title of my research is The Effectiveness of ot-parentship on Parental Resilience, Self-Determination and Functioning, and on the Functioning of their Autistic Adolescents. This research made possible through the collaborative efforts of many individuals, with special thanks to Dr. Talmuzor Crescenti and Professor Adina Meir. They both together are my PhD supervisors. I will begin with a short introduction on the challenges faced by parents of autistic adolescents level 1. They report a significant caregiver burden, parental success, and concern for their children's success in community and school environment more than parents of adolescents with other developmental disorder, and even parents of young autistic children. All of this can potentially lead to a reduction in parental resilience. Furthermore, here. Furthermore, unlike mother of autistic individual level 2 or 3, mother of autistic children level 1 are more likely to attribute their children maladaptive behaviors to intentional rather than biological factor. They are more likely to think that the child is lazy rather than recognizing that the child has difficulties with change or sensory regulation, for example. The transition to adolescence among the individuals with autism is characterized by increasing difficulties in daily function. Children's function included proper hygiene habit, room organization, meal preparation, academic tasks, peer interaction, and sexual relationship, and also sleep functions. During this period, autistic adolescents may face bullying and social rejection, while simultaneously becoming increasingly aware of their difficulties. A combination of these challenges can greatly increase their risk of experiencing anxiety and depression, as said before. This challenge and function arise from deficit across multiple dimensions, such as communicative, sensory motor, cognitive behavior, and motivational aspects. Each domain impacts a wide range of tasks, from room organization to navigating sexual relationships. A systematic review and meta-analysis of parent-focused intervention of autism reveals a pressing need for a structured, targeted intervention program for parents of autistic adolescents. If we look behind the need for a large and controlled study, the current program lacks two key elements: a comprehensive approach that considers all dimensions affecting the autistic adolescent, and a structured parent-focused program that tailor to the parent functional and mental health needs. I would like to introduce you to an intervention program called ot-parentship, like partnership, but parentship. OT, it's occupational therapy, developed in response to the lack and the needs that were just mentioned. ot-parentship is a short-term intervention program for that parent. This parent, the parent are the primary client, but the adolescents are the focus of the intervention, even though they are not physically present in the sessions. The program assists the 4 dimensions of the adolescents that were mentioned previously, creating a personal profile that served as a basis for the intervention. For the social communicative, we use the SSAS, the sensory profile. For cognitive behavior, we use the brief, and for the motivational, we developed an open questionnaire, evolution questionnaire. The program aims to promote parental resilience, parental self-determination, and parent functioning, with a secondary goal of improving adolescents' functioning. ot-parentship is a validated intervention. We have conducted research for content validation, and the results have been published. So the ot-parentship program consisted of 11 90-minute individual sessions. It began with an initial assessment to understand the adolescent's multidimensional profile and the parent needs. The program then guides parents through key stages: knowledge exchange about their child profile, collaborative goal setting, and structured problem solving to address real-life challenges. The final session included an evaluation and discussion of their progress throughout the process, as well as a new goal. We call it a transfer goal, which the parent will work on independently for 3 months. 3 months post-intervention, a follow-up meeting is held to reevaluate and assess the maintenance of the results in all outcome measures, and evaluate the transfer goal and determine if the parent has acquired the tool to independently advance their child functioning. We conducted a mixed method pilot study to assess the feasibility and the initial efficacy of ot-parentship. The results support its feasibility and show significant improvement in parent and adolescents' functional goals, as well as promoting parental resilience. The self-determination theory, SDT, emphasizes the importance of autonomy, competence, and relatedness for well-being. Research shows that parenting that support autonomy in autistic children promote positive outcome, while controlling parenting can lead to negative ones. Parental psychological needs play a crucial role in that dynamic, which autism symptom severity linked to less autonomy supportive parenting and parental frustration of their own needs for autonomy. Therefore, interventions that addresses the psychological needs of both parent and the child can improve child well-being regardless of symptom severity. This slide presents a mechanism of change in ot-parentship intervention mapped according to the SDT. A qualitative analysis of family who participated in the pilot study conducted by Einaf Kahlon identified 5 key themes and 14 sub-themes, shedding light on the therapeutic components and mechanism of change in the intervention. We found that 3 themes represent direct benefit for parents. The parent-therapy relationship, which included therapeutic alliance, therapist expertise, and long-term support. Reframing, which help parents better understand their adolescent profile, develop tools for analyze and practice mindfulness. And parental resilience, which fosters self-compassion, position parent as a change agent, and promote self-advocacy. In addition, 2 themes reflect the intervention indirect benefit, the parent-adolescent relationship, which involve effective communication, alliance, and also addressing feeling of being trapped, and improve family functioning, including co-parenting benefit and better adolescence performance. From this qualitative analysis, it appears that self-determination theory served as a suitable theoretical framework for understanding and mapping the therapeutic components that enable the intervention success. Parentship directly addresses parent basic psychological needs for autonomy, competence, and relatedness, while indirectly supporting the fulfillment of these needs in adolescents through changing parental behaviors. However, due to the small convenience sample, this finding and the feasibility findings should have been examined in a larger randomized controlled trial. Following the pilot study and based on its conclusions, the pragmatic randomized controlled trial was conducted to evaluate the effectiveness of ot-parentship. The inclusion criteria were parents of adolescents aged 12 to 18 with a medical diagnosis of ASD and normal intelligence, reporting unmet needs, adolescents unbalanced neurological or psychiatric co-occurrence or co-condition, parent with a significant parent health condition or ongoing parental guidance were exclusion criteria for the study. In the PRCT, we use a convenience sample. Participants were randomly assigned to one of the 2 groups. Randomization was achieved using minimization, considering age and gender for adolescents and educational level and relationship status for parents. The research group received the ot-parentship intervention as described. The control group received a video-based psychoeducational intervention that included 6 psychoeducational videos providing a generic explanation of a multidimensional profile of autistic adolescents, guiding participants to establish goals in challenging areas of occupation, and offering strategies for analyzing daily events and creating tailored problem-solving solutions. Both groups were assessed at 3 time points, pre-intervention, post-intervention, and 3 months follow-up. We measure three key outcomes domain: parental resilience, evaluated using the APQ; parent self-determination, measured through the PBNSR, assessing autonomy, competence, and relatedness in the relationship with their adolescents; and occupational performance of both parent and adolescents, assessed with the COPM. Equipment took longer than expected due to the dropout in the control group and scheduling challenges in the interventions group. 20 families in the intervention group and 16 families in the control group completed the intervention and were analyzed. This table presented demographic information of the final participants of the PRCT. On the left side, you can see the data about the adolescents, and on the right side, the data about the parents. As we can observe in the shaded variables, there were no significant differences in demographic data between the two groups. In this study, some family participated with both parents, while others had only one parent involved. To examine potential differences, we compared the scores of father and mothers from family who participated as couples. Since no significant differences were found across any outcome measures, we proceeded with a combined analysis using the mean scores of both parents to represent family-level outcomes. Let's begin with the result of parental resilience as measured by the APQ. We can observe a significant interaction effect of group and time between the research group and the control group. This indicates the different effect of the intervention on this aspect over time between the two groups. Specifically, the research group improved significantly the parental resilience measures from pre to post intervention compared to the control group, which did not improve. Regarding the self-determination measure, which, as mentioned, is divided into three parts. The first is competence. We can see a significant interaction effect of group and time between the two groups. The parent, the parent is in the research group improved significantly in the competence measure from pre to post intervention compared to the parent in the control group, which did not. For the autonomy and related measures, no significant group and time interaction was observed. However, the parent in the research group showed significant improvement from pre to post intervention, while the control group did not. Throughout the session, parents identified several challenges their adolescents face in various areas of daily living. These challenges included areas such as parent-child communication, room organization, family dinner, morning routines, parent-school relationship, and finding a summer job. This slide provides an example of how functional goals were set using the COPM. Let's take a morning routine as an example. As part of the process, the parents set both a goal for their adolescents and a goal for themselves. The goal set for the adolescents was, for example, to wake up independently using an alarm, get organized, and be ready to leave for school by 7:45. The goal set for the parent reflected the role in supporting this process. In this case, the parent aimed to improve their adolescent's morning routine by analyzing execution, providing reminders, and adjusting the environment within about 2 months. This example highlights the structured, collaborative nature of goal setting, where parents take an active role in promoting their child independence, while also identifying their own responsibility in facilitating daily functioning. This slide illustrates how the goal of the adolescents and parents were broken down into specific functional objectives as part of the intervention. While we won't go into the full breakdown now, this structured approach allows for a clear, actionable steps that support the adolescent's progress while defining the parent role in facilitating success. So regarding functional goals, a significant time and group interaction was observed for both parent and adolescents' goals. This interaction effect indicate that intervention impact on functional goal differed between research and control group over time. Specifically, the research group demonstrated greater improvement throughout the study compared to the control group. It's worth noting, however, that the control group also shows significant improvement, although to a lesser degree. It will be interesting to continue investigating this in the future as well. You can see here the result of the research group at pre, post, and 3 months follow-up. We can see that the results were maintained for 3 months after the end of the intervention for all measures. Regarding the transfer goals set in the end of the intervention for the research group, a significant improvement was observed after 3 months, both in terms of parent and adolescents goal achievement, performance, and satisfaction, as this suggests that the parent acquired tools to work independently with their autistic adolescents. I would like to share with you a brief part from the intervention evaluation meeting conducted with Sonia, Giора's mother, and Dr. Tal Mazar-Kersenti.
אני מרגישה שסוניה שנכנסה לטיפול, ואולי שאלה מאוד קצת קיצונית, אבל היא אחרת מזו שככה, שמסיימת עכשיו כאימא.
כן, כן. לא, בגישה האוניברסלית זה גם חשוב, כי אם הגישה שלי לא לשפוט, לראות את החסם ולהתייחס אליו בצורה אחרת, אז גם לבן שלי אני אתייחס אחרת. וגם כשאני כועסת, הוא נגיד, אני לא מרוצה מהתפקוד שלו, הילד מאבד, הוא מנסה לפרוץ גבולות. עדיין התגובה שלי היא שונה, בלי נזיפה, להגיד שאני לא מרוצה, להגיד את זה אחרת, זה מאוד חשוב. או אם אני מבינה שיש לי פה חסם, אני יודעת על מה אני צריכה לעבוד. וגם לא לשפוט את עצמי, אני יודעת שזה קשה לי. פתאום באמצע התוכנית הבנתי שאני לא מכירה את כל המסוגלויות שלי ושל גיורא, וגיליתי אותן פה בתוכנית.
Parent testimonial provide insight into the meaningful impact of the parentship intervention. They describe gaining a clearer understanding of their child, structure support method, and practical tools to build parenting and confidence. Many felt empowered not by starving for perfection, but by navigating challenges with clarity, self-compassion, and purpose. This feedback underscores the importance of addressing parental needs and as their growth directly impact their child progress. Limitation of our study, parents were recruited via advertisement, possibly indicating higher motivation and limiting generalizability. The intervention required significant time and effort, which may have excluded parents with limited resources. More couples in the research group compared to one parent participation in the control group may have influenced the result. The high dropout rate in the control group prevent direct comparison at follow-up in the COPM questionnaire. Further research is needed to explore the intervention long-term impact and to address these limitations. We are grateful to the family who participated in the research. Their contribution is greatly appreciated. Thank you for your time and attention today. It has been a pleasure sharing this research with you.